Imagine living with pain every single month. Pain so severe that it affects your daily life, affects your work, your relationships, and even your ability to have children. This is the reality of millions of women worldwide who suffer from a condition called endometriosis. Hello everyone, I'm Sandra Ananyami, a biochemistry and molecular biology student of the University of Health and Allied Sciences. Today, I'll be talking to you about endometriosis, what it is, how it affects women, treatment, and why awareness matters. Normally, the womb or the uterus is lined with a special tissue called the endometrium. The endometrium thickens every month and sheds during menstruation. However, in endometriosis, this tissue grows outside the uterus in places like the fallopian tube, ovaries, or the pelvic wall, where it clearly does not belong. Now, the problem here is that this tissue responds to hormone changes every month. Because it's outside the uterus, it has no way to exit, and this causes severe pain, inflammation, and scar tissue. The exact cause of endometriosis is not fully understood, but there are a number of theories surrounding it. Some of these theories include retrograde menstruation, where blood flows backward into the fallopian tube and pelvic cavity instead of outside the body. Research has also shown that genetics and the immune system is also a factor in endometriosis. Women with relatives who have the condition are likely to develop it, and also changes and mutations in certain genes that are linked to immune response and hormonal changes also increase the risk of endometriosis. On the immune side, the body does not clear the misplaced tissues properly and produces excess inflammation, which promotes the growth and the spread of the tissues. Hormonal imbalances also increase the risk of endometriosis. It is likely a combination of all these factors that make some women more vulnerable to the condition. Common symptoms include very painful periods, pelvic pain, heavy bleeding, infertility, and chronic fatigue. It is important to note that symptoms vary from person to person. One huge challenge with endometriosis is late diagnosis. Averagely, it takes from 7 to 10 years for a woman to be properly diagnosed with the condition because it is mostly dismissed as bad period pain. Currently, there is no known complete cure for it, but treatment options include pain-relieving medications, hormonal therapies such as birth control, and surgeries to remove endometrial growth. Lifestyle changes and support group can make a very big difference. Most importantly, early diagnosis and proper care can improve the quality of life greatly. Endometriosis, even though it's invisible, its impacts are very real. Awareness, early diagnosis, and proper care can go a long way to improve the quality of life. If you or someone you know experiences extreme period pain, don't ignore it. Speak up, seek help, and push for answers. Together, let's create awareness on endometriosis and break the silence and provide women with the care and support they deserve. Thank you for listening to me. Don't forget to like, leave a comment, hit the subscribe button, and share. Bye.